Dr. Gabala. So today we are going to take a good discussion about hypertension, and we're going to discuss all that you can know, all that you can learn about hypertension. So welcome so much.
Oh, thank you, Dr. Shipsy.
Dr. Gabala, pleasure. Now, before we go into the discussion of today, I think it's always good that our viewers get to know who you are, what your practice is, and where they can find you.
Well, I'm Dr. Mohsen Gabala, interventional cardiology consultant. I'm head of cardiovascular department in MP Shah Hospital. So we run clinic here in Westland, in the hospital, and in Village Market. I trained in Sweden, the medical school, and then I did my specialty both in Sweden and then moved to England. After England, I moved further to Canada to do fellowship in interventional cardiology, and I worked there for 5 years. Then moved to Kenya.
All right, pleasure. Quite a good experience. Now, so let's talk about the kind of services that you offer generally.
So in Ambisha, we have a cardiac clinic. We have many cardiologists. So we deal with hypertension almost on a daily basis. About 70 to 75% of our patients that comes to cardiology, they have high blood pressure. We run a service for heart attack or myocardial infarction if they come at any time of the day, like 24/7. That we take them to the cath lab to open the blocked arteries and we put a stent. We started that service since I moved here to Kenya, and it had been running effectively for the last 3 years.
Yeah.
We have research, we try to develop new methods. We will talk about that for the hypertension.
Yeah.
Both better and new treatment, new medical treatment, and non-medical treatment as well for the hypertension.
All right. What about in the outpatient setting?
So the outpatient clinic, it is on the 5th floor in Westland, or in Village Market, the 2nd floor. The one in Village Market is state of the art. We have all the new equipment that we run the clinic in the same way I used to run my clinic in England, in East Yorkshire. So we have a very advanced echo machine. We have all kind of examination that needed, like 24-hour ECG monitor. We have even 7 days ECG monitor that we can monitor the heart at home for 7 days. We can monitor the blood pressure for 24 hours, even if the patient is sleeping. We still can measure the blood pressure effectively. We have so-called tilt test, which is a tilt table. It's rather up to date now, so it is new in Europe to make the diagnosis for all patients who suffers of fainting or pre-fainting, what we call syncope.
Yeah.
So they come to us, we do investigation with the tilt test, which lasts about 45 minutes.
Yeah.
To know what is the reason for their syncope. If it is from the heart, if it is from the blood pressure, is it from the heart rate itself. All these things has different mechanism and a different treatment.
All right.
Yeah.
Great. I think it's important for us to understand the kind of service before we go now into hypertension, which is one of the things that you deal with daily, as you said, as a cardiologist. So to the simple man who doesn't know medical terms, what is hypertension?
Well, hypertension is the word tension is pressure, and hyper, it is over. So high pressure or over pressure is which is inside the blood vessel. So the people will not feel that their blood pressure is high. So it's done on a routine examination that the doctor or the nurse take the blood pressure, and it has to be taken in a proper way, that the patient has to relax 5 minutes and take the blood pressure in both arms. We don't only go after one readings, but we always want at least 3 different readings. If it is on 3 different days, it will be even better. Because it is, if you stamp the patient that he has high blood pressure, it is a chronic disease, it is for life.
Yeah.
So if we find that the blood pressure is above the normal range, then we will say that this is above the normal range, it is hypertension. Then we have to do some investigation, we have to do some tests, we have to measure the blood pressure even at home, better than the office. We sometimes put the 24-hour blood pressure monitor to measure the blood pressure during sleep and during waking hours to see if there's any difference. It will be a dipper if the blood pressure goes down very much during night and it is high during daytime. So it could be related to stress. We try to treat all causes of blood pressure, and we see if the blood pressure gets better without medical treatment, then we will keep them under observation and we will go on.
Oh, great. So you mentioned about pressure being above the normal. Will you just say the common number you use, the cutoff?
The cutoff, it is different. It depends on individual variation as well. So I would say in general, the optimal blood pressure is 120 over 80, the same like everyone else.
120 over 80.
So 120 over 80. But then we accept up to 139 that we talk about systolic, which is the upper pressure.
Yes.
Diastolic is the lower pressure.
The lower pressure, yeah.
So if we talk about the diastolic pressure, we can accept from 120 up to 139 before we start any tablets, except for diabetes patient. To diabetics, we only accept up to 135. If it is above 135, we will start the treatment.
All right.
That's for the systolic. For the diastolic pressure, we said 80 is optimal, but we accept up to 89. So in general, if I say that blood pressure on a normal individual who doesn't suffer of diabetes have 139 over 89, if it is above that figure, we have to start the treatment.
Okay, great. Now, let's say I am out there doing my business. One day I go to the clinic, coincidentally my pressure is 150 over, let's say, 90. What should I do over several days before being started on treatment?
So apparently, if you get your blood pressure, either you have a machine at home that you measure it yourself, which I even recommend that people, general population, can get that machine to help themselves or to help the relatives to measure the blood pressure. The most important thing about the blood pressure, before we start to answer your question, is if you have high blood pressure, you don't have any symptoms. So it is not the people believe that once you have high blood pressure, then you have headache. When you get headache, so the blood pressure goes above 220 over 130, which is very high. At that point, I would say, yes, you will have headache, you will have some visual blurring vision, you will have other symptoms. But between 139 up to 200, there's no symptoms.
There's no symptoms.
Yeah.
All right.
So, back to your questions, you said that your blood pressure was elevated at once. First thing I would say that, okay, you have to sit down, relax at least 5 minutes, and they take the blood pressure again in both arms, and to see if there is any difference between both arms. If it is still high, then it means that you have high blood pressure. Then we have to know the reasons for that. I would recommend, if you come to that level, that you have to see a doctor, because he will help you to go through your history to find out how do you eat, if you eat a lot of salt, if you eat less potassium, if you have vitamin deficiency, vitamin D. All these are factors that can predispose to high blood pressure. So we have to start to treat all these things. We have to do lifestyle changes. If you are overweight, we have to have a plan for you to start to go down in weight. If you suffer of physical inactivity, we have to try to find even a plan for you to start to do more exercise, because all these things will make the blood pressure to go up, and it will cause hypertension. Even if you start on medical treatment, still it will just go up. Instead of 1 tablet, you will need 2 tablets in the future, 3 or 4 tablets, if you don't deal with these factors. So if you are, of course, traveling, it is associated with stress, and we know that stress can cause high blood pressure.
Yeah. So in line with that, as we continue, let's talk about the causes of hypertension. What are these things, the different types that will lead blood pressure to rise?
So there are causes for hypertension. There are so many. If we say that there are two types of hypertension. The first type, which is the common, which is about 95% of the population, sorry, it's called primary hypertension, which means that we don't find a reason for that. So, but there are factors that we have seen in these patients that actually predispose them to high blood pressure. If you come from a family that many members of the family, first grade relatives, suffers of hypertension, definitely you will have the genes to develop hypertension about at age of 30 above. That's the first thing. And we said that the patient who actually drink alcohol, they are more predisposed to develop hypertension. Smoking, it is associated with hypertension. All recreation drugs like narcotics, hash, cocaine, all these things can cause severe hypertension that need a specific treatment. Then we talk about the diet. People use a lot of salt in the diet. So the salt is sodium, sorry, sodium chloride. It makes the blood pressure to go up. So the causes of the blood pressure or hypertension, as I said, that the primary, which it doesn't have any cause. So for the primary, there are a lot of predisposing factors. So we talked about the diet, the physical inactivity, obesity, smoking, alcohol, recreation drugs. All these will make the chance of developing high blood pressure much more than other people who doesn't have those factors. High altitude itself, it is a risk factor actually, and there is a lot of research done on that. You know, in Kenya we live about 2,000 or even more than 2,000 meters above the sea level, and that will affect the blood pressure. Even I have a lot of patients from Sweden, from Europe, and when they move to Kenya, they actually develop high blood pressure.
Oh wow! Okay.
The other factor which is important that you can actually do is obesity. If you can lose weight, if you lose every kilogram, 1 kilogram, there's 1 millimeter mercury less blood pressure compared to normal. So even if you have high blood pressure and you are on treatment, try to lose weight as much as you can, and try to do more physical exercise. Physical exercise is very, very important to treat the blood pressure. And then you think about your diet. You eat less sodium, more potassium. Potassium comes from fruits like banana, all kind of fruits, all green vegetables, so they contain potassium. Potassium protects us against high blood pressure. But so sodium will make the blood pressure more prominent and more obvious.
What will be the sources of this sodium so that we can avoid it? Mention to us the potassium.
Sodium, it is in the salt. Any salty things, it contains sodium. Because sodium chloride is our table salt that we use. Comes from the sea, of course. So sodium is it's actually in many drugs and sometimes in many conservative or in the canned food contain a lot of sodium. So you have to be careful about the food you eat. So that's the primary. The secondary type of high blood pressure, secondary means that it is secondary to something else. So secondary to another disease which can cause the blood pressure to go up. Like for example, a stressed person or a person who suffers of panic attack. So you imagine that you are under stress for a long time, not only acute stress but chronic stress. There is disease in the endocrine glands that we call, which is thyroid gland, for example. If you have a problem with the thyroid, it will affect the blood pressure. If you have a problem with the adrenal gland, which is above the kidney, it will cause diseases like what we call Crohn's disease. It is associated with high blood pressure, or Cushing with high cortisol. It will cause blood pressure. There's different hormones and the different endocrine glands which secrete hormones which can cause high blood pressure. There is another group, which is kidney disease or patient with chronic kidney disease. We call it parenchymal disease or renovascular disease.
Yeah.
Those patients always have high blood pressure. So if you go to dialysis department, you will find that most of the patients, they have high blood pressure. Maybe 90% of them have high blood pressure. Because the main problem with hypertension that the research has showed, it is a relationship between the brain and the kidney.
For high blood
and
pressure.
We will explain that later today in our talk, because actually it is very interesting research that came out for the last 5 years to understand what happened in your body to make you to develop high blood pressure suddenly. Yeah.
All right, that sounds great. So still on the causes. So you said largely genetics. If the family there's a hypertension, there's a likelihood chance. So can we have, like, let's say 4 out of 6 of your siblings becoming hypertensive, you are one of the 2 remaining, and you exercise, you eat well, and prevent diabetes from hypertension from happening to you?
It is a fight that you have to take up to postpone the incidence of high blood pressure.
Yeah.
Of course, if you win, instead of being 25 years old and developing high blood pressure, you can postpone it by 5 or even 10 years. You be careful about your body, careful about your activity, careful about your diet.
Yeah.
No alcohol, no smoking, so everything which is fun, you have to stop.
Yeah.
So in that case, you're actually fighting against the development of hypertension. These 2 factors that you cannot do anything about, like your age, of course, and your family.
Yes.
So if you come from a family with high blood pressure, yes, you will develop high blood pressure sooner or later, but you can make it later on in life, and maybe some people, they actually win the fight and they never develop high blood pressure.
All right, so you mentioned the different causes of hypertension, so one of them is genetics. So if, let's say 6 siblings, so 4 have diabetes and I'm the 5th one, I don't have. So hypertension, I can exercise and eat well and try to avoid from developing hypertension?
Yes, you can say so, but the thing is that it is like a fight between you and the development of hypertension. What you're trying to do is to postpone the disease to start by doing different factors. But the thing is, there are the fight can be won if you can change the factors. There are, of course, factors that you cannot change, such as genetics or the family and your age, but you can change your habits, like smoking, you can stop, alcohol, you can stop, physical inactivity, you can start to join the gym and start to walk. The cardio program of exercise is just walking 45 minutes 5 times a week. That will be enough for the heart. So the factors you can change, of course, you will start to work hard on these factors. Your diet, your alcohol consumption, all these things will make the blood pressure, instead of affecting you at age of 20 or 25, you can postpone it by 10 or 15 years. So at least you will have 10, 15 years free of medication. Wow. So I think once you know, and once you establish that your blood pressure is above the normal limits, you have to start to worry, and you have to start to work hard to postpone the treatment.
Yes. All right. Thank you very much. So we're going to continue right after the break. So let's take a break, and when we're back, we continue with the discussion on hypertension.
You are watching TV 47, the home of untold stories.
Sonadol Extra imetengenezwa kwa njia spesheli kupambana haraka na maumivu ya kichwa, mwili na hata meno. Sonadol Extra, hakika maumivu yakizidi, pata ushauri wa daktari.
Unataka kuendeleza the good times? Basi panda GOtv ikupandishe.
You always know what I want.
Ukilipia subscription ya package ya juu, unapewa upgrade to a higher package free. Panda tukupandishe, upate the best entertainment on TV.
This is the last.
Panda tukupandishe. GOtv, love it. You are watching TV47, the home of untold stories.
All right, welcome back again to the Body Garage, the art of well-being, and our conversation today with Dr. Kabala is on hypertension. So we are going to pick right from where we left. So, Doc, you told us about the causes of hypertension and everything. So let's look at this concern that who are the people who are at risk of hypertension? You know, maybe what age group and any other circumstances that can put us to that.
We can say in general, hypertension is associated with an age-related disease, which means that you grow up in age, you will have more chance to develop hypertension and more chance to develop target organ failure or complication of hypertension.
Yeah.
So it is very well related to age. But in Kenya, we have actually said that the age start to come down because of different factors that we have discussed some of them. But it starts even at age of 25, 30. So we have patients nowadays, younger patients coming with very high blood pressure that we have to start treatment very early in life. And of course, if you start hypertension at age of 20 or 25, we have many years in front of you that you have more chance to develop complication compared to other people.
Yeah.
So that's one group. The other group is women. Women during pregnancy, they can develop high blood pressure. It could be just essential hypertension or just simple high blood pressure, no other symptoms, no proteinuria, like losing protein in the urine, or any other symptoms, or it can come in pregnancy-related complication like eclampsia or pre-eclampsia, which is a serious disease and it associated with high blood pressure. Then we noted that even cardiac patients, most of the cardiac patient and patient who get stroke, most of them, they have tendency to develop high blood pressure as well.
So by cardiac, you mean patients with a primary heart disease?
Yeah, so even patient who, I wouldn't call it primary because until the patient comes to us, of course we don't know anything, but investigation showed that the patient comes with the heart attack and then we notice that together with the heart attack, his blood pressure is very high. So in that case, we don't know which one is the first. But I believe, of course, hypertension has led to heart or myocardial infarction. So it is very well connected. The same happened with stroke. If the patient comes with bleeding in the brain or coming with a blood clot in the brain like stroke, then we noted that the blood pressure is as well elevated. And of course, we have to take that in consideration. Any patient with kidney problem, diabetics, because they have more contact with the hospital, so they have more chance to measure the blood pressure every now and then. And once we see that it goes high, we have to start treatment immediately.
Great. Now, let's talk about the symptoms.
Yeah.
Earlier on, you mentioned that a greater part hypertension, you don't feel anything, but at some point something shows up. So let's talk about what are the common symptoms, even if mild, for hypertension. On top of that, how long does it take for hypertension to manifest, starting from the time where an insult is put, over how long?
It is a very difficult question. If you start with your second question, how long it takes for the blood pressure, to say the truth, there is few studies done on a smaller number of people that they have follow up. So one of them is a veteran study in the US for all people that came from the Second World War. They looked at the blood pressure and then they follow up them for 20 years. and they notice which one can develop the blood pressure. And of course, as we mentioned, you go up in age, you go up in the blood pressure, and so on. When I talked about 120/80, it's only for the young people.
Yeah.
So actually, we can accept higher blood pressure for elderly people, like 80 or 90. But in other words, if I make it reverse, I wouldn't say that there is a good blood pressure threshold that I would say that you are protected if you have that blood pressure, or the patient is well protected against other complications.
Yeah.
We don't know that the answer to that question yet. So the only thing we know that we have the blood pressure, we go after our guidelines and our classification according to the American Heart Association or European Society of Cardiology, and we go after those guidelines and those recommendations for now with the treatment.
Yeah. All right. So let's talk about the symptoms now. Something
The symptoms,
has happened.
as a rule, the first or the symptoms for the hypertension, no symptoms. There are no symptoms at all for the high blood pressure. You could have a blood pressure of 170/90 and you feel completely fine. So the main symptoms of headache, as I said before, that it doesn't happen very often, and when it happens, it has other side effects or other causes.
Yeah.
When the blood pressure goes very high, severely high, what we call malignant hypertension, like 220 or 230 over 130, that can cause a headache.
Yeah.
It can cause blurring of vision, like you start to see that you feel that you need a new glasses, but actually it is the problem with the retina because of the blood pressure. And then you can have symptoms from the complication itself. Once you have symptoms, we have to look for complication.
Yeah.
So we take ECG, for example, and to see that the first effect on the heart, that the heart muscle gets thicker with time.
All right. So let's continue that conversation as we look at which parts of the body hypertension targets.
Right.
Yeah.
So as I said, the first organ is the heart, of course, because the heart is very close to the blood pressure.
Yeah.
So once the blood pressure it goes up, so the heart has to guard itself and it has to work harder to contract the same amount of blood against higher blood pressure.
Yeah.
So the heart has to work more hard and more powerful. So the wall of the heart, instead of it is 11 millimeter, which is normal, it gets to 12, 13, or even 14, and this can cause other problems in the future as well. It can cause angina, it can cause heart attack, it can cause heart failure. So that's the first organ is the heart. The second organ is the kidney. So the kidney, once it is the blood pressure start to increase, it will affect the kidney as a filter. So you will start to lose a lot of protein in the urine, and that's what's called proteinuria. So you lose all the food that you eat, it become converted into amino acid or protein, and you start to lose everything in urine. And ultimately it will develop into chronic kidney disease, and it can cause even terminal disease that needs dialysis. It can affect the brain, it can affect the blood vessels going to the brain or the brain cells itself. It can cause obstruction of the circulation to the brain, and it can cause stroke. Or a blood vessel can rupture and it can cause bleeding. So that's we say the heart, the kidney, brain, and the other organ as well is vision and eyes.
The eyes,
So the retina gets affected by the blood pressure. It can cause bleeding in the retina. It can cause what we call exudate, and it can affect our vision, both temporary or permanently if we don't deal with it.
All right, that sounds good. Now, in relation to that, does hypertension, some people say, somebody is high-tempered because he has high blood pressure. Any relationship with that?
Of course, hypertension is very well related to stress. So it's any kind of stress, if it's even physical stress. So a normal person, once they go to the gym and they start to do exercise, his blood pressure has to go up. Together with heart rate, it will go up. So patients sometimes come to me that said, I measured the blood pressure when I was running, and it was really high, and the heart rate. But this is completely normal physiological process. But if the blood pressure goes above certain level, even during exercise, we call it hypertensive response, which means that this patient, we just keep in mind that he might develop high blood pressure in the future because of the elasticity of the blood vessel that does not accommodate high pressure. It makes the pressure reading to go up. And then the other stress is emotional or mental stress. When we are emotionally excited or emotionally stressed, there is normally two hormones in the body that become secreted. The first one is adrenaline, and the other one is cortisol, and both of them, they cause high blood pressure. So the adrenaline, it will go and make the heart to start to pump very rapidly. We get palpitation, and then our blood pressure goes up. Even we became like shaking hands, tremors. All these things are because of adrenaline. Adrenaline only comes with acute stress. But if the stress is a little bit insidious and takes longer time, then it becomes a chronic stress, as the body knows that the body needs a little bit hormones which can work over longer hours, like cortisol. Cortisol does the same effect as adrenaline, but it stays for long weeks or even months.
All right. So it is true there is a relationship between stress and hypertension.
Absolutely.
All right, great. Now let's talk about before we go to treatment. So here is a person is at home, has been measuring their blood pressure over a period of time. They're all elevated. So we say they are now a new hypertension person. So how should they walk their journey from there?
So first, when they come to us, we try to get like a history to see what other disease, what their lifestyle is. Do they use any other recreation drugs or smoking or alcohol, all these things. And then we start to give them information. Once we started the tablets, it doesn't stop. So of course, you have a disease with high blood pressure. Once you get the tablet and we are happy about the results, it means that the blood pressure will go down to the optimal level. It doesn't mean that you stop the drug. You have to continue the drug the rest of your life. Together with non-medical or non-medicamental treatment, which we talked about, like diet and lifestyle modification. These two will have to go in parallel with each other. And of course, if we know that there are already complications to the blood pressure, then we have to be very quick in starting treatment, and we have to be very aggressive to lower the blood pressure. We know that even blood pressure can affect memory, and it can affect the brain function, so we have to take that in consideration as well, that we choose the drugs, and we, as I said, complication means that we have to be quicker. To start with medical treatment.
Medical treatment, all right. So at that point, do we look at complications right there, or you come to look at it later? So as we think about that, let's take a break, and then we will pick from there. So stay tuned.
TV 47, the home of untold stories. Mount Kenya University takes pride in being an academic giant with some of the best infrastructure, imparting knowledge to the best brains in the country and the region. Our members of faculty are keen to deliver market-driven programs in science and humanities with a keen focus on linkages with relevant organizations. Join us today and train with the best to become the best. Mount Kenya University, unlocking infinite possibilities.
Wiki hii kwenye tasnia ya elimu.
Kwanza ningependa kupinga hoja ya mwasilishi wa kwanza kutoka shule ya upili ya Mtakatifu Rita.
Asha kumsima tusi, lakini Hakuna venye utaenda kuangalia video mbaya ama chafu kisha unaanza kusema usalama wako unategemea watu wengine.
Wewe kama utajihusisha na mambo kama ya kuchoma shule, wewe jua ati ni wewe tu utaenda gerezani, wala si mama yako wala baba yako.
Tena kuna wavyele ambao ni wazembe tena sana. Atamwachilia hule mtoto ingali ni saa 6 usiku. Mtoto anaelekea wapi saa 6 usiku? Usalama huo uko pia mkononi mwa mwanafunzi.
Are you looking for a college that will shape your future career? At Candy College of Beauty and Applied Sciences, we offer advanced courses with personalized attention to our students. Come and get your diploma or certificate in cosmetology, hairdressing and beauty therapy, diploma in community development and social work, or certification in catering and accommodation operation. We also offer diploma in nutrition and dietetics and many more. All of our graduates have secured employment in the job market, while others have gone into entrepreneurship. What are you waiting for? Join us today. For more information on how you can enroll, visit us at the London Beauty Building, 5th floor, Taveta Road, Nairobi, or call us on 0726 031 109 or 0784 515 606. Facebook, Candy College of Beauty and Applied Sciences, or on Instagram, Candy College of Sciences. Our January intake is ongoing. Candy College of Beauty and Applied Sciences is the cutting edge college.
You are watching TV47, the home of untold stories.
Welcome back again to the Body Garage, the art of well-being. We are continuing the conversation on hypertension, and right now we want to go into the details of treatment of hypertension. So how does the treatment of a confirmed hypertension look like?
So treatment always two different components. The first component is lifestyle modification, which is as good or as important as the medical treatment itself. So change the lifestyle, change the way that you eat, change the quality of the food itself. Start to think of eating more vegetables, more fruits, anything that contains potassium, less sodium, decrease alcohol, decrease smoking and the other recreation drugs, and the most important that you live healthy, that you start to do more exercise.
Yeah.
You do that hand in hand, and if the doctor decides that this blood pressure is really too high, I don't want to have any complication until you manage with your lifestyle modification. So he might start with a tablet or 2 tablets to lower the blood pressure at the same time. So, but the big problem with the blood pressure that once you started the treatment, you don't stop the treatment after 1 or 2 months, because you stop, the blood pressure will goes up.
That's a question I'd like to add, because many people say, so for how long do I take this blood pressure medicine? Will I get healed? And so such questions.
Well, when I came to Kenya, actually, I had that problem because we are, as a doctors, we are allowed to write prescription only for 1 month. Most of the insurance company, they said, okay, you have to write 1 month and the patient has to come to see the doctor in a month's time. So I write the prescription 1 month, and the patient, for one reason or another, if he came like 2 months later or even 3 months, because he said, oh, I find myself good and I feel well, even before I took the tablets, and now there's no difference. But the blood pressure actually goes down, and then they stop after a month, and they believe that, okay, the doctor gave me tablets for 1 month, then I might even stop.
Yeah.
And that's the biggest problem. And we did a lot of studies for the hypertension, and the scaring figure that we have seen from these studies, that more than 45% of the people prescribed with antihypertensive, they don't take the medication.
45%.
45% of most of the population
in Kenya.
That's in all over the world, and I will come more specific to Kenya. So I would say in Europe, in Sweden, it's 32 to 35%. In Europe in general, it goes up to almost 38%. In Kenya, it's 42 to 44%.
All right.
These are completely non-adherent to the drug, which means that they don't take the drugs. We have figures from Kenya Cardiac Society here that they did STEPS survey a few years ago, and they have the same figures. So they found that 43% of the Kenyan population, they don't take the drug completely.
So that by 43% you means 43 people out of 100
yes
don't take the medication.
Exactly, but wait, because plus 43, these 43, there is another 18% who take the drugs every now and then. We call it partial adherence. So there's a complete non-adherence is 43 plus 18%, so it's more than 60 or 70%. They mess around with the drugs until they get complication, and then they have a motive to take the drugs. But we don't want to come to that level. We want to give the drugs and to prevent complication.
Yes.
Because once you have complication, we can't treat it properly, of course.
Yeah. So adhering to the medication is important, even if you're feeling okay now.
Yes.
All right. So just I would like you to drive that point really well to the viewers to understand why it is important to take the drug even when the pressure is fine, even when you're feeling okay.
It is very, very important what you said, because actually we agreed that high blood pressure, you don't have symptoms. So that's a healthy person who feels well, who doesn't have any symptoms, but he has a high blood pressure that potentially can kill him. So we started treatment, we start with one tablet. Sometimes some people have 2 or 3 different tablets to lower the blood pressure. And they feeling well before the tablets, and they feeling even well after the tablets. So they don't actually lose the motive because they don't know. But the thing is that those who get a complication, they know that it is serious and we are not lying about the future. So they are the one who actually stick to the treatment, and they become very aggressive actually in getting the treatment. Some people, they feeling well before we started treatment, and then they get complication of the treatment itself. Like the tablet for the blood pressure, there's many tablets. One group called calcium channel blockers, like amlodipine, amloson, which is very famous in Kenya, and for even black African, they tolerate that tablet much better than all the other modern tablets. There's other modern tablets like angiotensin converting enzyme receptor blocker, like losartan, candesartan, telmisartan. Many tablets for the blood pressure. We have to choose the right tablet to the right patient. But most of the tablets have a side effect. If you take amlodipine, for example, you can get ankle swelling, which is very famous and very common, or you get cough. So then, as a doctor, we have to motivate the patient who doesn't have any symptoms to take 3 or 4 drugs to lower the blood pressure, which is a very difficult task.
All right.
So, and it all depends on the doctor. So we have to find something else.
All right. So let's look into a few quick questions. So one, so there's the medications and lifestyle. There is also follow-up. How feasible has it been for patients to follow up? So how frequently should a patient with hypertension be seeing the doctor for checkups and everything? How has that been? What are the challenges? What will be the best way to deal with that?
I would say that high blood pressure without complication, it's enough once every 3 months. If the patient takes responsibility for these 3 months to measure the blood pressure, once he sees that it is above the normal limit, he will contact the doctor and he come directly to see him or communicate with messages. But a patient with high blood pressure with complication, he should see the doctor once a month. Most of the insurance company, even NHIF, they actually stipulate that the patient has to see the doctor once a month.
Once a month. So without complications, 3 months.
3 months.
With complications, once a month. That's answered now. How important is it for patients to measure their blood pressure at home? Because many times there is no record at home. We come measure in the office and that is it.
The problem with the office blood pressure that there is something called white coat syndrome. That the patient, once they come to the clinic with a lot of people, some people they feel shy to sit with many 100 or 50 other people, and then they go to the nurse. The nurse sometimes is busy. She doesn't wait 5 minutes before she takes her blood pressure. So the office pressure always higher than the home pressure. So we always recommend that the patient will measure the blood pressure many times a day or a week or even a month if it is stable, and just write it in a list and then bring it to the doctor, so the doctor can have an idea how it is at home.
And that really helps a lot.
It is actually more to be trusted than the office pressure, as I mentioned. So white coat syndrome, white coat is the doctor, they used to have like a white uniform, and once the patient see the doctor, they get excited and the blood pressure will go up. So that's why we want the real blood pressure from home.
All right. So the encouragement is that if you have high blood pressure, to measure blood pressure at home and come with the records when you go to see the doctor.
Exactly.
That will be the take-home message.
Yeah.
All right, great. So you already answered this, that can I take blood pressure medication once and be cured? And you say probably no. All right. So when we are talking on the sides, you mentioned something that is coming up, some new treatment options. What are these?
That's right. So the medicine we take for the blood pressure, it is not for cure. It is only to lower the blood pressure. To stop the medicine, blood pressure will go up. But the question, is there any cure for the hypertension? And the answer is yes.
There is a cure?
There is a cure for the blood pressure or for the hypertension.
Okay.
So we talk about primary hypertension, that we can't find a specific cause for the blood pressure. Secondary hypertension, of course, there is a cure. If we treat the cause, it will, if we treat the glands, the thyroid, the renal, the endocrine glands, or the renal artery stenosis, all these things, it will make the blood pressure to go back to normal without even treatment. But the primary hypertension, which constitutes 95% of the patient, the research for the last 15 years have been going on, and we found out that the hypertension is actually an interrelationship between the brain and the kidney.
How is that?
So the brain sends impulse to the kidney artery on both sides, on both kidneys, the right kidney and the left kidneys. And those signals, it will go to the kidney to tell them retain the sodium and retain the water and make the blood pressure to goes up. And those signals, once they are stimulated, it goes into vicious circle. So it makes more water retention, more sodium, more blood pressure, more sodium. So it becomes like a generator.
Self-sustaining.
Yes. Self-sustained generator to make the blood pressure. So if we disconnect that signal, specifically that signal only, that to retain the oxygen, to retain the sodium and the water, then we can actually treat the blood pressure. So the studies started in Europe, in Germany, and it's called RDN. Renal, R for renal, and the DN, denervation. So denervation, to take out those nerve receptors in the renal artery. So we did the first catheters. It was not very optimal, and we couldn't have it. It was straight, and we couldn't take out all the signal. We talk about maybe 10-15% of those receptors. So still there is about 80% of the receptors or the signals coming from the brain to the kidney. So, but it worked. At that point, it worked, but not effectively. And then there was a pause for a few years, and then came another catheter that had another shape, which is called the spiral 3 catheter. And this catheter had the facility of going into the renal artery, going around the wall, and being sure that we can take out the receptor by 80 to 90%. And what the first study we did with medication, and we found out that people who were taking 5 medications, they go down to 1 or 2 medication.
Yeah.
And we did another study, compared those who went for medication, those who went for that procedure, RDN, and there was no difference. After 4 months, blood pressure will go down, and it will be equivalent to medication. So we adopted that technique here in Mbishan. We are the only hospitals in Kenya that actually can offer that service. It is available in South Africa, and it will be only Kenya and South Africa, the whole African continent. But it is available in Europe, it's available in US, in Canada, and it is well established and it's well known.
Wow. All right.
So we hope that treatment actually will save a lot of Kenyan from many drugs, many antihypertensive.
Okay. Yeah. Sounds like the future looks bright.
It is indeed. Yes, looks much better.
All right. Thank you very much, Dr. Gabala. We appreciate your time. Because of time, there's a lot to talk about. Thank you for setting these minutes and part of your day to be with us.
Thank you.
We appreciate
very much, Shipson.
Yes. So that has been our discussion on hypertension. Thank you for